Hi everyone, it's Ella Christofferson with Prairie Plains Community News, and today I'm reporting from right here in rural western South Dakota, where the wind is strong, the coffee is stronger, and lately the need for mental health support has been outlasting the coffee. Our local Prairie Horizon Rural Health Community Clinic just launched a brand new nurse-run mental health and primary care integration program based on the collaborative care model, or CCM. The community has a lot of questions, and lucky for us, I've got two of the people leading the charge. Joining me are Jeremy, one of our family nurse practitioners who just wrapped up his psychiatric mental health NP certification, and Allison, our RN case manager, and the person everyone knows you can't hide anything from because she will follow up every time. Thank you both for being here.
Thanks, Ella. And yep, guilty. I'll talk about mental health with anyone who slow blinks at me for more than 2 seconds.
Well, hey, happy to be here, but also guilty, because if someone misses an appointment, I will find them. But I'd like to think I'm kind and supportive, but if anything, persistent.
So Jeremy, let's start with the big question. People keep hearing about the collaborative care model, and I swear somebody asked me if I meant group therapy in a barn. Help us clear this up. How is the CCM different from how things usually work in primary care?
Okay, so first off, no barns involved. CCM is more like taking the healthcare puzzle pieces and finally snapping them together. In traditional care, mental health is sent off somewhere else, another clinic, another town, sometimes another month of waiting. But with CCM, the mental health provider, me, the case manager, our very own Allison, and the primary care team all work together in one plan for each patient. We meet weekly, we review cases, adjust medications quicker, track real symptoms like the PHQ-9 scores so nothing slips through the cracks. It's structured teamwork so not everyone is doing their own thing in different corners of the healthcare universe.
So it's not refer the patient and hope they go. It's wrap the team around them right here.
Exactly, and in rural areas, that can literally be life-changing.
Allison, I want to loop you in here. Because you're often the one trying to figure out how to help somebody who can't take a whole day off to drive to Rapid. What kinds of telehealth will the clinic offer, and is any of it reimbursable?
Well, thank you, Ella, for asking. But yes, it's not just reimbursable, but it's necessary for a rural area like ours. Under this new model, we'll be offering video mental health visits for therapy-style follow-ups, medication check-ins with Jeremy, phone outreach for people who say, I don't do computers, secure messaging for quick check-ins, and remote symptom tracking for depression, anxiety, and yes, Medicare, Medicaid, and most private insurers reimburse these visits, especially when they're part of CCM. The goal is simple. Remove every barrier we can. I've had patients cancel because their truck wouldn't start, or because the babysitter fell through. Telehealth solves a lot of these problems.
I love that, Allison. And honestly, some people feel more comfortable opening up when they're in their own home. Maybe with their dog crawling on their lap. Or cat.
Exactly. If that helps them feel safe, then we're all for it.
Okay, switching gears to something that we all feel in our bones. Let's talk about burnout. Healthcare everywhere is struggling with it, especially in these rural areas. Jeremy, how is your team trying to protect your staff through all of these changes?
I love that you asked this. Because honestly, this model is as much for the staff as it is for the patients. CCM reduces burnout because you're not on an island as a provider. The RN case manager supports the long-term follow-up. PCPs aren't juggling every mental health need alone. Standing orders let RNs work at the top of their license, and weekly team reviews get everyone support. It creates an environment where we're not just reacting all day, we're planning, adjusting, and sharing the work.
So, instead of each provider feeling crushed under a pile of messages and refill requests, the system actually spreads it out.
Exactly, and the research backs it up. Teams using CCM see higher job satisfaction and lower turnover. It keeps us human, which is kind of the point.
Allison, I want you to have a moment to brag here because you really are the glue in this model. What does case management look like day to day within the CCM?
Well, Ella, you know me. I do like a good color-coded spreadsheet. But in real terms, what I do is track progress on depression anxiety scores, call patients who are struggling, help set realistic goals, work with transportation issues, insurance, medication barriers, whatever the obstacle is. I communicate between providers and support self-management so patients feel in control. In rural healthcare, people face barriers that have nothing to do with motivation. They're logistical. So I am here to make those obstacles manageable.
So you're part nurse, part coordinator, part therapist, and part detective.
Well, you're not wrong.
Well, this has been amazing. The collaborative care model truly seems like the right step for our little corner of South Dakota's integrated care, mental health support, telehealth, and a team that actually feels like a team. For everyone listening, the program at Prairie Horizon Rural Health Clinic launches next month, and patients can start enrolling soon. Jeremy, Allison, thank you both so much for being here today and for the work that you're doing for our community.
Thanks, Ella. Excited to get started.
Well, thank you so much. But remember, if you miss an appointment, I will call you.
And that is why this model will succeed. Thank you for tuning in, everyone.